Repercussions of fear and anxiety. Anticipatory anxiety is another primary driver of the nocebo effect. A handful of studies to date have associated post-concussion symptom burden with experimentally induced stress, daily stress, and anxiety sensitivity. When anxiety leads to avoidant behavior, concussion recovery can be affected in a more downstream fashion as well. The case of cogniphobia can be illustrative here. The phenomenon originally referred to headache sufferers who worried that, due to personal vulnerability, pushing through concentration or problem-solving difficulties could be unsafe and/or detrimental to health. In concussion, cogniphobia has been associated with the avoidance of physical activity and traumatic stress triggers, as well as lower performance on memory testing. Analogous patterns may play out with photophobia and cervical kinesiophobia following concussion. Cogniphobia is the avoidance of cognitive activity for fear that doing that activity will make your situation worse. It will give me a headache. Oh, I can't do that. It'll flare me up. Okay, that is fear avoidance. You're not doing things based on an anxiety of something that could occur. However, there's no real evidence to support that it will occur. While often making one more comfortable in the short term, avoidant behaviors ultimately tend to worsen symptoms. Theoretically, we may consider whether some degree of learned non-use has occurred, whereby due to habituated avoidance of a specific behavior, example mental exertion, one's function remains far below one's potential. Such behaviors may prevent resiliency through utilization of one's cognitive reserve. Corresponding brain networks could subsequently atrophy or undergo negative neuroplastic changes with protracted disuse or avoidance. This is something I say all the time to my patients, in efforts to try and get them to realize that a little bit of pain and pushing through stuff is a good thing. For example, if anyone's done weight training out there, if I am going to go and do squats, and if I haven't done legs in a while, let's say I've been off working out, I've been on vacation for a couple months, and I come back and I'm just like, from the gym, and I come back and I say, look, I gotta get back into squats. So I go to the rack, I do squats. Even if I do much less weight than what I typically do, I'm likely gonna be sore. You should see me walk out of the gym after squats. I'm walking like Frankenstein. I can't move, okay? Next day, I'm a mess. The day after, I'm even worse. My legs are so sore. Even 3 days later, I'm sore. Now, if my response to that was to say, I can't do squats because it makes me sore, it gives me so much pain, it flares me up, and I look at that as a negative, right? I look at that delayed onset muscle soreness as a negative, not realizing or interpreting that delayed onset muscle soreness is actually repair and making me stronger, right? Because if I were to say, I'm not doing squats anymore because of whatever, maybe I lower my weight, right? Oh, it's too sore, I'm gonna lower the weight, I'm gonna pull back. Am I gonna get stronger or weaker? I'm gonna get weaker because I'm not doing the activity. But if I was to say, oh yeah, I was so sore after, that's good. I'm gonna go and do that again because it's pushing me, it's challenging me. And I go in and I do squats again. The next time, I'm still sore, but I'm only sore for 2 days now. Next time, I'm gonna do it again. Boom, now I'm sore for 1 day. Now I'm not getting sore at all. Time to up my weight. I want to be sore. I want to feel slight symptom increase. Otherwise, I am not doing shit for myself. If I go to the gym and work out to the point where I'm not getting sore, I'm not doing anything. I'm not having any growth. There's no growth there. And that's really what we're talking about here. If somebody has a fear avoidant behavior of, I can't do that because I get too symptomatic, there's no evidence to support the fact that having an increase in symptoms will flare you up or have any type of long-term negative repercussions. I'm saying this for benefit. I'm not trying to be, I'm not trying to downplay or minimize. I'm saying this for your benefit. If you're out there listening to this right now and you're struggling because you're afraid of doing things, first of all, you should probably have somebody to help coach you through it so that you have somebody to lean on in the event you do have a quote-unquote flare-up. But this is for your benefit. You need things that are beneficial for concussion are exposing yourself to the stimulus that creates symptoms. It's also exercising, okay? And all of these things, at least from what you've likely been told in the past, are things that were thought to be detrimental for concussion. But that's actually not the case. They're actually beneficial for concussion. right? And if we had been doing them all along, we probably wouldn't be in this chronic state that we're currently in, okay? In support of this notion, studies of prolonged complete rest after concussion have generally shown worse outcomes compared with relative rest, and multiple studies now support a role for practice-based therapy as a primary treatment basis for rehabilitation. And also I would add in here that exercise, especially even in the acute stages. I know Dave sometimes watches these, but Dave Lawrence is doing a ton of work on this at the University of Toronto right now, showing that exercise even as early as 1 day after injury could potentially speed the recovery of the concussion. Okay? I think it reduces the quote-unquote medicalization of the injury itself and gives, kind of reduces the chance of these nocebo effects. Whereas if somebody comes in to see me and I go, oh man, you have a concussion? Well, you could be in for a long haul. Right? That can create all sorts of stuff. There's long-term potential repercussions there, and you've had a few concussions before, so that's gonna be tough to recover from it because you've had this history. And what are you gonna think? You're gonna leave there and think, that's it, I'm screwed. And what's gonna happen? You're gonna develop and have persistent symptoms. Whereas if you come in and see me, I say, look, yes, it's a mild traumatic brain injury. There's actually no structural damage to the brain, which is good news. You're going to have symptoms for a short period of time, and then you're going to recover. Most people recover in the first 7 to 10 days kind of thing, right? Some people have some symptoms that can linger, but the good thing is that most of those are amenable to treatment. They require things like exercise and rehab and maybe some dietary changes, but they're all treatable, right? See the difference there, and what's that patient going to think? Okay, great. I'm in the right spot. I'm able to exercise. I'm able to kind of go to work. Perfect. That person will do better than the other person who's been told to rest and do nothing.